shoot it from a different vantage point tonight. So thank you for having me tonight. I'm Dr. Michael Twyman. I'm a heart attack prevention expert. I'm also known as the biohacking cardiologist. And if you don't know what biohacking is, we'll definitely describe it tonight. And when you leave here, you'll be beginning biohackers if you haven't already started your journey on it. So this is a picture from a couple years ago when I went to Bhutan with my wife. Bhutan is a lovely country about the size of Indiana, but it's really far. It's like a 14-hour flight away from the States. So I was trying to figure out how not to die from the jet lag. And so I was reading some articles online about how to mitigate jet lag and came upon a guy named Dave Asprey. Dave Asprey is the Bulletproof executive, and he had an article on his blog about wearing special kinds of glasses that would mitigate some of the light that went in your eyes, and maybe that would help reset your circadian rhythms, your 24-hour cycle. We'll talk more about the circadian rhythms coming up. I did not understand the science at that time. I just bought the glasses, wore them on the plane, and looked like the Unabomber. So did not get kicked off the plane, amazingly. Got there in 12, 14 hours or so, got off the plane, got to the hotel, was wearing these red ones because it was middle of the night there, and the red ones tell your brain it's nighttime, don't wake up and spike cortisol. Didn't understand that science at that point, but went to sleep that night, got up the next day, and then we did some earthing grounding, which I'll talk about a little bit later too, but was I jet lagged? Sure, but it was probably about 1/3 as intense as I was imagining it, and it was over by the next day. So I was like, there's something to this. So I'm gonna go enjoy this trip, and then when I get back to the States, I'll go back and start reading about this. And been down that deep rabbit hole for the past 2 to 3 years about biohacking, mostly through the mechanisms of how light affects your health. And for any of my patients who have seen me before, once I kind of really drank the Kool-Aid on this, they've never seen me not in the office wearing a pair of blue blocking glasses. So.
What is the name of the glass you're saying?
Blue blocking glasses.
Blue blocking, thank you.
So we'll talk about that in the sleep component of this. But biohacking, this is Asprey's definition. I won't read it, but you can just think of biohacking as health optimization. What can you do to live the best life? That doesn't necessarily require you to take a bunch of medications or procedures, or even take a bunch of supplements. How do you organize your life and your environment to have optimal health? So this was actually me probably 18 months ago when I actually met Laura for the first time. It was because of biohacking I actually found out what Osteostrong was. I didn't know what Osteostrong was before they contacted me. I heard it on, I think, one of Asprey's podcasts, so I understood some of the science behind it, but now I've done a deep dive into the science behind how these machines work, and then also how this X3 bar works, which I'll talk about. But I met Laura through the biohacking world. I'm the founder of the St. Louis Biohacking Club, and she reached out to me and said, we'd like to have you guys come to our Olive location. So we went there, got to demo the machines, and show some of my colleagues what it's about. So without biohacking, I might not have been here tonight. But anyway, if you guys don't know, these machines they do, strengthen your bones. But from my standpoint, the most interesting thing that they do is that they allow your body to put on more muscle mass. I'm talking about why muscle mass is so important. So this is where a little bit of basic science, but the mitochondria, they're the organelles inside your cells that make energy for you. So your heart and brain have the most mitochondria. 1/3 of your heart is actually mitochondria. So mitochondria are like the engines. They make fuel for the body. If your mitochondria break down, you basically have brownouts wherever they break down. So you got to really mind your mitochondria to have optimal health. Approximately 80 to 85% of diseases might occur when there's a dysfunction in the mitochondria. So you might have heard that, my mom, my dad had heart disease, I must have bad genes, I'm going to get it too. That's not necessarily true. There are certain genes that put you at higher risk, but it's generally your environment that your body's exposed to that interacts with your mitochondria, and how the mitochondria work determines if you have a disease, yes or no. So if you do these 3 or 4 things, you're probably not going to see my cardiology colleagues in the hospital. So the upper left, the sunrise, the sun is something that is key to longevity and optimal health. You were supposed to evolve outside, up until 1870s when the light bulb got invented by Edison. People lived outside 90% of the time. Now the average person lives inside 90% of the time. And the artificial lights that you bathe yourself under and the screens that we're exposed to, they are like artificial suns that program your body a different way than Mother Nature intended. So we'll talk a little bit about some sun hygiene. But if you see every sunrise, you set your clock for the day optimally. The Bono glasses, I just put that in there because when I first started wearing these glasses 2-3 years ago, people thought I was trying to be like Bono or something. I said, I'm not like, any type of rocker or anything like that, but I had a pair that were much more yellow at that point. So these ones, they're new advanced technology lenses, so these don't look as yellow. I do have my evening ones, which sure, I'll just switch out and just do them in the red ones for now. But these red ones typically wear about an hour or two before you go to bed. These red ones block all blue light, all green light that enters your eye. Those wavelengths of light are very stimulating to keep you awake. If you block those, you basically tell your brain it's nighttime, start making the hormones that you need to sleep. So if you're in front of a bunch of artificial lights and screens at night, this helps get your brain ready to go to sleep. The barefoot in the ground, that's earthing and grounding. I'll talk a little bit more about that in water. Water is very important for how your mitochondria work because it's the water your mitochondria make. So I will do briefly about kind of my day job. My day job is a cardiologist, and I decided, a few years ago it was much more interesting to try to prevent people from having heart attacks than to treat them while they're having a heart attack. I can still do that if needed, but I'd rather get to them at a much earlier stage. And unfortunately, half the time that people first find out they have coronary disease is they have a heart attack or they have sudden cardiac death. Both these gentlemen had sudden cardiac death. One made it, one didn't. Tim Russert died at the set of NBC Studios. He had passed a stress test about 2 months before he had that fatal heart attack. But what's not as much talked about is that he actually had a high-risk CT coronary calcium scan. The calcium scan is the best test to tell you non-invasively if you're at high risk or if you're truly indeed low risk of a heart attack. Bob Harper, the biggest loser, guy looks like Adonis on the outside. He dropped dead in the gym. If he didn't have bystander CPR, he wouldn't be here. He ended up having a genetic abnormality in one of his lipids. He has lipoprotein A, which 20% of the population has. So your doctor should check it at least once that you have it. If you don't have it, great. If you have it, you have to be much more aggressive monitoring your other risk factors because you're at higher risk of having plaque build up in your heart arteries or your carotid arteries. So, people sometimes underestimate what actually drives plaque in your arteries. It's not just cholesterol. Cholesterol is always going to be present in plaque, but it's not the number one thing that's getting into the arteries, or I should say injuring the arteries in the first place. Typically it's more inflammation. So everybody here's probably had their blood pressure checked, the cholesterol. I'll talk a little bit more about how cholesterol isn't the boogeyman that people think it is. You've had your blood sugar tested, you even know if you smoke and you know if you're overweight. Those are the top 5 things that can contribute to vascular disease. If you control those 5 things, you're at much lower risk. But there's about 395 other things that are driving the plaque formation, and you need to go looking for them. So this is just a picture. You have 3 arteries on that side of the heart. It's not as easy as thinking like your arteries are like a sewer pipe and they're just filling full of sludge and now it's 100% blocked. It's actually that the wall of the artery is getting damaged. So the plaque builds up in the wall of the artery first because the wall got scratched up. And at this amount of blockage, you're not going to have any symptoms. Typically, you have to have about a 70% blockage in your artery before you're going to have symptoms because you can't get enough oxygen or nutrients downstream. All right. So this is the test I was mentioning that Tim Russert had, the CT coronary calcium score. This is a workhorse for my practice. So essentially anybody over the age of 40 who's not previously had a heart attack, had a stent, had bypass surgery, or a stroke should consider getting this test done. It's essentially a mammogram for your heart. It tells you, do you have calcium building up in the walls of the artery? Calcium is supposed to be in your bones and teeth. Ideally, you have calcium in your bones, making strong bones with this equipment. But if you have calcium in your arteries, it indicates that you have plaque in your arteries. The higher the calcium score in your arteries, the higher the risk that you are of having a heart attack. So it's just a basic CT scan, takes about 5 to 10 minutes, very low dose radiation. It is about the same amount of radiation as a mammogram. There's no IV, and there's usually no significant prep work for it. And most places around St. Louis do it for about $100 or so. The reason I have a picture of President Clinton and astronauts is those are 2 groups of people now that are required to have CT coronary calcium scores as part of their executive physicals. So Clinton was probably the last one not to get one. Clinton had passed all his presidential physicals. He did all the stress tests he was asked to do. And then only a couple years out of office, he ends up having a heart attack and getting multi-vessel bypass surgery. So people ask, well, how could he possibly got bypass surgery? He kept passing the stress test. again, the stress tests are only good if you have a 70% blockage. If you don't have a 70% blockage, you're very easily going to pass a stress test. And astronauts, it goes without saying, if you're in space and you have a heart attack, there's nobody coming to save you. So if your calcium score is 0, you're low risk. If your score is higher than that, they're not likely to let you fly. So, skip that for now. The second test that I typically recommend for patients who really want to know their risk of vascular disease is called the Carotid Intimomedial Thickness Test, or CIMT. It's a carotid ultrasound of your neck artery. So there's a carotid ultrasound that looks at the flow called the duplex carotid. It's using the same piece of equipment, but it's measuring something slightly different. So instead of measuring the flow, which typically is a late finding, so if your doctor listens to your neck with a stethoscope and hears like a whooshing sound, that's known as a brewery. It's like your finger over a garden hose, you just hear kind of whooshing out. That indicates you likely have a fairly severe blockage in your carotid artery, and that puts you at higher risk of stroke. This test is trying to find you at much earlier stages. So it's essentially measuring the thickness of your artery. The thicker your artery, the more inflammation there is of the artery, and the more soft plaque that's building up in the artery. So this is me a couple months ago getting my own scan. Unfortunately, I'm now biologically 44, but my vascular age was like 37 or something like that. So you're as old as your arteries. So I usually tell patients, if they come in, get scanned, and their arteries are an 80-year-old man and they're 55, they want to probably do something about that. So we'll do some more comprehensive testing to try to figure out what's putting that plaque in the artery in the first place. But this is the best test to tell you that if you have plaque, you do something in your lifestyle, your supplement, your medications, can you regress that plaque? This test will show that in 6 to 12 months. If you make a change, you'll see the plaque getting smaller. So just showing the picture of the duplex part. But I should back up a little bit, and talk about the endothelium. The endothelium is the inner lining of your blood vessels. It's 1 cell thick. If you pulled out all your endothelium from your blood vessels, it'd be about the surface area of 6 tennis courts. So it's one of your largest organs. And one of the major things that it does is it releases nitric oxide. Nitric oxide is a gas that dilates your blood vessels, but nitric oxide is also a gas that acts somewhat like Teflon, prevents stuff from sticking to your arteries in the first place. Healthy arteries release a lot of nitric oxide. So this is why exercise is important, because that stimulates nitric oxide production. Green leafy vegetables and beets, those things break down in your saliva, ultimately get converted into nitric oxide. And then being outside in the sun, mainly when UVA radiation is out, so that's shortly after sunrise, a little before sunset, that window, when that sunlight hits your skin, the blood vessels come to this top of the skin, they release nitric oxide to dilate so that the sun can go into your blood. That's one of the reasons your red blood cells are red, because it's absorbing those wavelengths of light to ferry the light to where it needs to be taken in your body. But your endothelium is the first thing to get damaged 6-7 years before plaque starts building up. It's somewhat like a tennis net. If you start cutting holes in the tennis net, there's just easier things for things to leak through there. And there's a blood test that can measure somewhat your function of nitric oxide release called ADMA. I routinely check this in my office. But a more sensitive marker is to actually do basically a stress test of your endothelium with a device called the EndoPAT. It's a 15-minute test. Basically, it's little finger probes measuring the flow in your fingers, and we're measuring if your arteries can release nitric oxide. The way it's done is you basically have a blood pressure cuff on the arm. It ceases blood flow for 5 minutes. So you have this pins and needles sensation in your hand. You open up the blood pressure cuff after 5 minutes. The blood rushes back down into the hand and arm. And if your arteries are healthy, they see this huge slug of blood, and they will have shear stress. The blood comes down there, and there's small blood vessels. If they're healthy, they release nitric oxide to accept that huge slug of blood coming down the stream. I'm not going to go too much in cholesterol because I get into more of the biohacking stuff. So we'll talk about 4 things that I typically recommend patients do other than pills and procedures to reduce the risk of having a heart attack. And it's all about lifestyle. So there's 4 things, kind of a 4 pillars or 4-legged stools, I sometimes will call it. So if one of these legs doesn't work, you're not going to have optimal health. So those things are your optimal nutrition, your optimal exercise, optimal stress relief, and optimal sleep. Sleep is generally the most important. Sometimes I say it for last, but I'll hit it first tonight. But sleep is when your body repairs the mitochondria. Those things that make energy, they need time off from when the stressors of the day happen for them to repair themselves. So eating is a stress. You have to burn oxygen and fuel. Your body has to repair that damage. When you exercise, that's a stress to your muscles and your system. your nervous system. You have to repair that damage. If you don't sleep well, the mitochondria never get to repair themselves, and you don't get to work on optimal parts. Sometimes you're working on like 10-year-old tires. You can still work, but you're not near optimal at that point. So sleep is extremely important. I start first off with, if you have a medical condition that's affecting your sleep, go get it treated. So if you snore, stop breathing, you wake up in the morning with headaches, you feel like you didn't sleep all night, you feel like you gotta take naps out the day, or your bed partner tells you, I can't, you sound like a freight train, you might have sleep apnea. Sleep apnea is very common. Like, I think there's 18 million people in the US have sleep apnea that's either diagnosed or not diagnosed at this point. You can diagnose sleep apnea with home sleep studies now. They've got watches, looks almost like the WatchPad device. I did one at home recently just as a demo to see how it was. It wasn't that uncomfortable. I was actually able to sleep with it on. Fortunately, I didn't have sleep apnea and I don't need treatment. But if you have sleep apnea and get it treated, your body's able to repair itself. If you have sleep apnea and it's not treated, you're going to have more risk of having high blood pressure. You're going to have more risk of having vascular disease because sleep apnea puts a lot of stress on your heart. There's a lot of pressure in your lungs trying to open the airway back up. That's getting transmitted to the heart. And also that just tends to raise your adrenaline levels, your epinephrine levels, and your cortisol. When you have those high fight or flight hormones up, the body starts wearing out faster. So sleep hygiene is very important. So, if you have a young kid or young grandkid, you don't pick them up and just throw them in bed at night. You have kind of a wind down routine. So adults should somehow have a routine that they like to do as well. So, sit, talk to your spouse, read a book, take a warm bath, sauna, whatever you like to do to kind of wind your brain down. Ideally, it should not be done with technology because technology will stimulate you. But once you retreat to your sleep sanctuary or sleep cave, as I sometimes call it, it should be dark. Dark is so much that you can't see your hand in front of your face, so blackout curtains, or if you can't do that, an eye mask, and then anything that is lit up in the walls. If you travel with me, you'll see me covering stuff up with duct tape or black electrical tape, so little flashing lights in the hotel room, just put little stickers over everything at night so nothing's flashing in my hotel room at night. Cool, 68 degrees or cooler is ideal. Your body's core temperature dropping is a big signal to the body to start sleeping, especially getting into deep restorative sleep. If you're a hardcore biohacker, you may have heard of a chili pad. A chili pad is a mattress topper that circulates cold water through it. You can dial it down to 55 degrees if you like. That's really cold. I've only done that once or twice. Usually I'll keep it about that 68 degrees if I use it. And then quiet. That goes without saying, if things are startling you awake, you don't get into those deep levels of sleep and you start saying those lighter levels of sleep. So earplugs if you're in a place that isn't quiet for you enough, or use some kind of white noise machine. And then minimize tech, many reasons why, but the light from the tech stimulates these receptors in your eye that destroy melatonin. People know about melatonin as a hormone, but it's a hormone of darkness. And only after 3 to 4 hours of darkness does it get released. You cannot replace the melatonin by taking a pill. It's not the same thing as the way the body made it. So you make melatonin throughout the daytime as the light is exposed to your eyes and your skin, but it only gets released from your brain after 3 or 4 hours of darkness. So that's why at sunset, ideally, you minimize your tech, but if you're going to be using the tech, you protect your eyes, giving you a pair of blue blocking glasses, because this will at least filter that light out from your eyes, and your body can start going into that preparation for sleep. Because melatonin is like the starting gun for sleep. Melatonin isn't the thing that actually keeps you asleep. But melatonin is also very important, as it's one of the most potent antioxidants, preventing your body from rusting. And melatonin is also, it's not as simple as this, but it's the fuel to repair the mitochondria at night. If you don't have enough melatonin, the mitochondria can't repair themselves effectively. And one reason to minimize the tech is, one tip, don't keep your cell phone near your head while you sleep. There's numerous case reports. I've actually had one patient, it actually happened to her, had years of nightmares. She moved her phone away from her head, the nightmares went away. Your mitochondria are like little sensors, they're always sensing the environment. If you have a radar jammer in the form of a cell phone by your brain at night, you're jamming the mitochondria signals of their environment. So your phone should be as far away from you as possible. If you have to have your phone in your room, if you can put on airplane mode, better, but at least 12, 15 feet away from you and not anywhere near your immediate vicinity. Minimizing blue light is important. I just mentioned that. Yeah, if you do what that gentleman did, You wake up in the middle of the night, look at your phone to see what time it is. That white light going into your brain will tell you it's noontime, and you'll spike cortisol. You're gonna have a hard time going back to sleep, and you won't have restorative sleep if you keep doing that. There's a couple different software programs for your computer. One's called Flux. Flux is free. Iris is free, but they have a premium version. Both of those will automatically start dialing down the amount of blue coming from your screens at nighttime. So you can set it that sunsets in St. Louis, your screen will turn more orange. And then the iPhones and the Droids also have their own software that can do that as well. So this is always a joke at my house. You don't have to put on the red light, but at my house you actually do. At nighttime, there is no bright white lights at my house. I shut them all off, and we have a couple of rooms where we have just red LED bulbs. The red light doesn't affect your night vision. You can still see, do what you need to do, but it's basically like a dark room or a submarine, but you tend to have much better sleep when you don't have those bright lights at 9, 10 o'clock at night. Exercise, important, and I'll just show this because I just think it's a funny picture, but this is the X3 bar. I've been actually demoing this thing for about 6 weeks now. I like it. It'll take a little bit more convincing before I start convincing patients to start using this thing as their only form of resistance training, but the variable resistance is available with this device. So the basics are that if you're doing a bench press, maybe you can only get 100 pounds off your chest, but you could resist 300 pounds coming down because you're stronger with the resistance. So this is designed so that you're fatiguing your muscles in the full range of motion. So I'm gonna give it a couple more weeks to see how I like it, and then I'll let you know how the results are. But resistance.
Dr. Jake wish you invented this equipment too.
Yeah. So after he invented this equipment, he had all this data about basically muscle fatigue and such, and he eventually figured out that your muscles are 7 times stronger in this certain range of motion. And he's like, well, weight machines don't do it the way I would want to, and so he eventually figured out that these resistance bands, and they're extremely thick. They look like leather belts, how thick they are. So it's high quality how things put together. I've only injured myself twice with it, so that's the other caveat. One time was just keep doing the push-up, and I was getting it off, and it came back in the bar, caught me in the head. So I got a nice little ding there. Not too bad. But the other one was that, it's got that super strong band.
Yeah.
And I'm sure Johnny just, pumps them out, but I was just using the medium band, but well, how bad could this thing be? And so I put on the biggest band, and I could do 3. I'm like, holy cow, I can do this. And I was totally fine that day. The next morning I got out of bed, I was like, I must have slept funny on my arm. I couldn't move my arm like this, and I was like, what did I do? Eventually I figured out, I used that machine too much, or that device too much, and I inflamed my bicep tendon. So I ended up using some biohacking techniques with my red light and saunas and everything else to stimulate the inflammation to go down. And after about a few days, it was gone, and then went back to the much lighter band. So
when in doubt on the X3, always go
always
lighter.
go lighter. Use the white. But resistance training is extremely important. So you don't have to use the X3 bar, but resistance or strength training is key. The more muscle mass you can carry as you age, the better you tend to do. Your muscles are your metabolic engine. It's what burns your fuel. Without muscles, you don't tend to do well. Perfect example, my brother, very fit, much more muscular than I am, got very sick a few months ago, ended up in ICU on a ventilator for a few days. Ended up losing 12 pounds of muscle during that hospitalization. Couldn't walk well when he was leaving the hospital, and they actually sent him to rehab for a few days. He's a active duty firefighter. He's very physically fit, and this beat him up that bad that he had to go to rehab. If he didn't have that much muscle mass to lose, he would have probably had a much, much longer recovery. Because when you're sick, you break down your muscles to repair what's damaged. So you break those amino acids down as your emergency bank. So you gotta do whatever you can to maintain your muscle, and ideally try to keep growing your muscle as you age. If you become sarcopenic or low muscle mass, you're gonna have all sorts of issues. You're much more likely to get osteopenia and fractures. These devices will help with that, preventing that. But if you have a strong base, you can put more muscles on it. But I will briefly talk about cardio as a cardiologist. Cardio is important, but resistance training is way more important for longevity. You can get enough cardio if you do enough intensity with your resistance training. But if you do cardio, interval training is probably more preferred for most people just because it's time compressed and you get better results in shorter amount of time. If you do chronic cardio because that's the sport you like to do, you like to run, bike, swim, well, do it because you like to do it for the swimming or just the activity part of it. But at a certain point, you're not getting more benefit the longer you go. Your body has to be stressed past the point of not necessarily breakage, but you know, the body's like, this is too much stress, you sleep, you repair yourself, now you can go harder again. So that transitions into the recovery part of it. So exercise and eating stress the body. If you don't recover well, you're not going to do well with it. So sometimes, you know, we'll get more into the nutrition part, but if you focus too much on the exercise and food and don't sleep well, you're not going to get the benefits that you're expecting. So these two gentlemen were both #1 players in their respective sports. Federer rarely ever broke down in his career. Woods had multiple back injuries, had surgery, was out of the game for over a year for a while. You know, the ideas were that, you know, that one of them prioritized recovery more. And Federer, you know, rumored to sleep up to 9-10 hours a night sometimes and takes days off from training. Woods was going every single day. He obviously had some other issues that kept him up at night, and he got up and would run some 5Ks in the middle of the night, go lift weights at 3 o'clock in the morning because he couldn't sleep. You know, when you don't sleep, you don't repair yourself. So he just ended up breaking down earlier than he should have. What I typically talk about for recovery, from a cardiology standpoint, is measuring your heart rate variability, or HRV. Your heart rate is not supposed to be 70, 70, 70 like a metronome. As you breathe in, it expands. You breathe out, it contracts. The further that it expands, that's how variable it is. It's a good marker of recovery. So if you have good or wide heart rate variability, you're physiologically not under stress, and it's probably a day you can push it pretty hard. If your heart rate variability is very tight, you may be overstressed, you may have overtrained the day before, it's probably a day you don't want to push it as hard. And heart rate variability is a very good sign that if you chronically have low heart rate variability, you're very likely to end up with cardiac rhythm issue, high blood pressure, coronary disease. It's just a marker that something bad is happening to the heart. There are different devices, different watches, different chest straps that can measure your heart rate variability. I know they have the devices here. I have some of these at home myself, but this is red light therapy. The LLLT, that's somewhat the older name for it, low-level laser therapy. Now it's more known as low-level light therapy, but more medical people usually call it PBM, or photobiomodulation. So photo light, biology modulation changing. So you're changing your biology by the light that gets impacted on it. So you can think of the red light devices as a way to externally charge your own battery. They're really good for musculoskeletal injuries or inflammation. You know, 20 minutes to the affected area tends to bring down the inflammation much faster. But the other thing that it can do for side notes are that it can improve collagen production, so it helps with wrinkles, does help with testosterone production if you shine it in the right spots for men, and it can also help with charging the water in your cells, and I'll talk about that in the food section. But
we also have full body. We have the same machine is on the screen next door as well.
Okay, yeah, I know you're about to get that. So,
Full body.
yeah. So yeah, so when you have a full body one, you can treat a larger area and sometimes even less time. So, you know, the next picture, this is not, this is high-level biohacking. So there's a friend in town that has this device for medical uses. I use it for non-medical uses, let's say. It's more for health optimization, but this is an IV red laser. This device can actually do UV, can do all these other different wavelengths of light. I was doing a Myers cocktail, which helps with mitochondrial health, but she's like, do you want to try the laser? I'm like, yes, I do. So she hooked up the laser, and you do like 20 minutes of this intravenous laser. Don't feel anything, or you shouldn't feel anything abnormal while it's going on. But I noticed for 24 hours I had more energy, and the way it actually works is it's actually charging the water in your blood vessels. It's basically like an external battery charger. But the reason I show this is that it's interesting is that all this data for light therapy, for the most part, came out of Russia, and because of the Cold War, all that was behind a wall for so long that scientists didn't talk to the scientists here, and now it's just getting rediscovered by the Western scientists. But this may be one of the reasons why the Russians were so good at certain sports for a while, because they were frequently known to be doing this light doping. Doing intravenous laser is considered doping according to the Olympics. There's a team handball thing from Bulgaria a couple years ago got busted for doing this. So you cannot do IV red lasers if you're in competitive sports, but if you're a weekend warrior or you're somebody sick, there's a tremendous benefits of the intravenous laser.
How about just fat and tired? Will it work with that?
Yeah. Well, it may help with the tired part. When you sleep is when your body loses body fat that it doesn't need. So you gotta focus on the sleep.
I just wondered,
ask a question, you're gonna get
Yeah,
an
no, no,
answer.
yeah, you'll get the answer. So, and then other than light therapy, the other thing that really helps with recovery is cold therapy. So cold thermogenesis or CT. I mentioned a little bit in the intro that, sunrise is very important. That morning sun, as it breaks the horizon, that light that enters your eye without sunglasses, without regular glasses, and ideally without contacts, enters your eye and turns on a part of the brain that makes the hormones that you need to make for the day. It raises cortisol, your sex hormones start getting made, and it wakes you up. So if you don't see the sunrise and you only get up at 9, 10 o'clock and you see the sun midday, your body gets a different signal. You've missed the starting point for the day. But I haven't missed a sunrise on purpose since the beginning of 2019, and this was a day last year when it was -3, still went out there. Yes, I had most of my clothes like fully up to here, but my eyes were exposed to the outside for at least 5 minutes, and then I went inside. But if you're somewhere warmer, the more skin you can expose in the morning time, the better you're going to do. So this is just the examples of the cold therapy. So that's Asprey in one of his cryo tanks. Cryo, I've done it many times. Cryo makes you feel good for a little bit, but cryo is probably more gimmicky than anything. So cryo is just a liquid nitrogen tank that you stand in, and you see all this smoke, and they dial it down to like -140 degrees, but it's air. And air doesn't transmit cold nearly as much as water does, or nearly as much as metal does. So your outer skin will turn pink probably, and you're going to feel cold at the end, and you'll probably feel good for a couple hours. But the strategies that they say that it's going to make you burn fat for 36 hours, your metabolism's going crazy, it's probably not. So do it if you'd like to do it, but if you're really going to get into recovery, use water, use ice. It's more effective, and it has better transmission. So Michael Phelps, obviously one of the best swimmers ever. He trained in cold water. He was swimming in like 55-degree water for a while. I mean, that's a chilled tub that he's recovering in. That's an eye-cooled tub. So the colder that you can get, you basically shrink down certain things in the mitochondria. When they shrink down, there's heat released, and that heat release makes it more efficient for energy to be transmitted through the mitochondria. So the guy up at the top is Wim Hof, the Iceman. He's done some amazing feats. He's run like a marathon at the Arctic Circle without training, but he's been doing all this cold training for many years. He's also basically been able to train his immune system not to get sick. When he got injected with, it wasn't coronavirus, but got injected with actual toxins from a strep bug, or a staph bug, which normally makes somebody extremely sick, potentially kill them. His immune system was turned on so much by the cold, he didn't get sick from it. So he's got some Guinness Book of World Records. So just look him up, Wim Hof. So we'll talk about nutrition. Nutrition, I'm not gonna say food is not important, but you need to focus on the full package. Light is gonna be the thing that grows your food. Focus on your light first, then focus on how the food enters your system. Because the food is basically information to your mitochondria. Your mitochondria break down that food into electrons. Those electrons are energy, or should we say they have energy, and they pass it along the mitochondria, and at the end, an energy substance called ATP gets pumped out. So food is energy and information. So you need to focus on basically the engines, the mitochondria, because the mitochondria have a broken spark plug, and you put in premium gas, you can eat organic, you can eat perfectly. It's not going to work very well. So you got to focus on the mitochondria first. So to get the mitochondria working, you can almost put anything into the system and it's going to work. But this is just a picture of photosynthesis. Essentially, the sun, it's plants. Plants are grounded to the earth with their roots. They get water, and they use the CO2 from the air to make glucose out of air, essentially. Then you eat the glucose that's in the plant, or you eat the animal that ate the plant. Your body then breaks the stuff back down, and you reverse the process. You break the glucose down, you then breathe out the CO2, and the mitochondria make water. And you're storing energy and information in the water that the cells make. This is obviously a nice picture, nice double rainbow, but two things. It just shows you how light breaks down through different wavelengths. Wavelengths are like your radio station. So KC is different from, I don't even know the points on anymore, but I start talking about, the 157 point and KC are different wavelengths. So different color lights do different things to the body. And the beach, that's the place you can go earthing and grounding. So might skip over this a little bit, but if you want a good book about water, how it actually works, there's a book by Gerald Pollack called The Fourth Phase of Water. Water is more complex than solids, water, liquid, and ice. But water, from a mitochondrial standpoint, is likely acts as a battery. You can charge up that water and use it for energy. Earthing grounding helps with inflammation lowering and also is another source of energy for you. So the earth is negatively charged. You have your shoes off, you're on the ground that is not man-made. Your body will accept those negative electrons from the earth into your feet. It's not necessarily like you're actually eating, but it is in ways. So you may notice if you go to the beach, you're probably not as hungry at the end of the day. It's not just because you're on vacation, it's because your water is getting charged up by the sun, and if you're barefoot in the sand, you're soaking up electrons that can be run in the mitochondria. So I don't prescribe a particular diet for every single person. It's all individualized. So I have to know what your context is, your story is, and what your health goals are. But if you need 5 kind of tips tonight, the 5 best tips I have is eat seasonally for your environment, meaning that if it grows locally in your area, your body is primed to eat at that time of year. Nobody's gonna be 100% perfect on this, and it's very hard to do it year round. But the biggest example is that tropical fruits are not in season in St. Louis. Yes, they get shipped in here 365 to your local grocery store, but your body is not primed to break that stuff down this time of year. The way you can think of it is you have 4 surfaces. You have a surface on your eye, your skin, your gut, and lungs. All those surfaces have to match. So if you eat a pineapple in January in St. Louis, that pineapple was grown in the sun. You put that sun into your gut, but your skin and eyes see it's -3 outside. I'm freezing. How did this pineapple get inside me? That is a mismatch of information to the system, and that can contribute to inflammation. It will not kill you to eat a pineapple in January, but if you want to be optimal, you would only eat what your body was seeing in its local environment. 200 years ago, if you couldn't catch, kill it, fish it, plant it, or harvest it and store it for later, you didn't eat it. So the closer you can get to a diet your great-great-grandparents ate, the more optimal you're going to be. Seafood, as long as you're not allergic, but the seafood is mostly important for the DHA component of it. DHA is one of the omega-3 fatty acids. Your cells need DHA to transmit energy from the environment to the cells. So without DHA, it's like having a half-charged iPhone. It works, but not for as long as you want it to be. Time-restricted eating is probably important for almost everybody, but especially those who have prediabetes, diabetes, people trying to lose weight, people who have issues with their sleep. If they do time-restricted eating, they're likely to have improvements in those areas. So time-restricted eating is compressing the time of day that you're actually eating. So your body has a circadian rhythm, a 24-hour cycle. The 2 major things that set that cycle are the light that enters your eyes and hits your skin. So that's why the sunrise light is important. But the timing, the nutrients that come in are the things that set the liver and the gut clock off. So ideally, 12 hours or less every day for almost everybody, every day of the week if you can. So when you wake up, first thing you put in your mouth that is not water usually will start the clock for the day. There's literally clock genes in the liver and gut. They start making different proteins once they see certain things come in. They need 3 to 4 hours to turn off that machinery. So if you're starting at 6 a.m., you should be eating till maybe 6 p.m. at the latest and giving your body 3 to 4 hours of rest before you go to sleep so that those things can shut off the machinery. Because if you don't shut off the machinery, you will not go into fat burning mode. So if you eat up to 10 o'clock at night, put your head down at 10 o'clock at night, and you're trying to lose weight, your body's gonna wait till 2 a.m. before it can make that switch. So you're only half the night to burn fat. So if you're trying to lose weight, constricting the time you eat is as important, if not more important, than what you're actually fueling the body with. The other thing that's important is timing your protein. I mentioned earlier about sarcopenia, lack of muscle mass. So sarcopenia is lack of muscle mass, osteopenia is lack of bone mass. Those are both proteins. You need protein in your diet to prevent that stuff from breaking down and also to build up those compounds. So you can build up muscle mass by lifting weights, but the other way to do it is timing of your protein. As you age, you tend to get anabolic resistance. Your muscles don't listen to that same message as you were in your 20s. When you're in your 20s, you probably eat pizza and barely do anything and still have muscles. If you're 50, 60, you need to be much more careful of your resistance training and your protein, otherwise you're not going to have optimal muscle mass. So Protein from whatever source, ideally, is going to have a full complement of amino acids. So you can do this with plant protein, but you're going to have to usually eat more of it, probably 30% more of it, to get that same amount of protein. But you generally need at least 30 grams 3 times a day of protein. And it's based on blood volume. It's not necessarily based on your body mass. Now, if you're trying to put on more muscle mass, you might have to eat more protein than that, but bare minimum 30 grams 3 times a day. And then I usually put in here clean water. The reason I recommend spring or glacier water is because it does not have fluoride in it. And irrespective of what fluoride does for your teeth, fluoride doesn't allow a big battery to be built up in the water battery in your body. And you want to have a big battery, you don't want to be blocking it. So drinking sources of water that don't have it naturally is going to be key. And then stress. Stress is ubiquitous. Stress everybody will have. It's just how do you respond to that stressor. So you have something known as the autonomic nervous system. It's your fight or flight response is your sympathetic tone. Your rest and relaxation is your parasympathetic tone. So when the bear is chasing you, you dump cortisol, adrenaline to run from the bear. Cortisol provides sugar for the brain and the muscles. Cortisol also makes your blood stickier, the platelets stickier, so that if you're injured, you don't bleed to death, you will clot. But your body doesn't know the difference between a bear chasing you and you're angry that somebody cut you off in traffic. So you have to find ways that you can bring that parasympathetic tone back up and put it back in balance. There's a couple of things that can improve, your parasympathetic tone. I don't have an absolute favorite for everybody, but I usually recommend meditation, yoga, deep breathing exercises. Just regular exercise for some people. Firefighters I give talks to, they hit the gym and that's their stress reliever. Fine, but but they need to find something that can get them back in balance. There is a device called HeartMath. I do have my version here, but HeartMath is a device that plugs into your phone, has a little clips to your ear, and it measures that heart rate variability that I was talking about earlier. And it gives you biofeedback. So meditation can be hard for beginners because you don't know exactly what you're supposed to be doing. You don't know if your mind's racing, is that normal? It's absolutely normal. Your mind's not supposed to be completely blank. If it's blank, you might have a bigger problem. But this actually gives you feedback, is it working? So it takes you some different breathing exercises, and if the thing turns a certain color, you're balanced. If it's still red, you still need to kind of slow your breathing down and try to pull it back in balance. So that's what it would look like if it was normal. That's what it would look like if it was abnormal, stressed.
Can you do that to my husband real quick?
Sure. Yes, he can do it. He looks like he's pretty balanced right now. So that's the overall presentation. I do thank you guys for your attention. I will be available for question and answer. I have a practice I opened up in August in Clayton called Apollo Cardiology. I focus exclusively on heart attack and stroke prevention. I still do general cardiology, so if you have an issue that isn't related to vascular disease, I still can manage it. But my goal is not to have patients go into the hospital. So I work with them extensively in the outpatient world, doing the calcium score testing, those who need it, the CIMT, the EndoPAT, advanced blood work, and then fine-tune these 4 legs, for people. So, if they need help with nutrition, I go down that pathway and have resources for them. If it's exercise, I have friends that can, are exercise physiologists or can tell you which gyms to work on. So, but if you're interested in, potentially working with me or have family or friends, I would much appreciate it. I do have cards available, but my website's apollocardiology.com. And if you want to see some of my biohacking stuff, I mostly put that on Instagram. I'm Dr. Twyman or Dr. Twyman on Instagram. My more professional stuff is on LinkedIn, so I'm also Dr. Twyman on LinkedIn. So again, I thank you guys for your attention tonight and open it up to any questions you have. Yes, ma'am.
You were talking about having your sleep cave dark.
Yes.
Like, what if you get up to go to the bathroom at night and you tend to like a little night light on? Is that a bad thing or not?
No, it's a great question, and that's not uncommon. It's just that the night light, ideally you would get one that is amber or red, because that won't affect your night vision. So there's a website, lowbluelights.com, that sells some of those, but you can also go on Amazon, just look for an amber colored bulb. The other trick is just, if you get the pair of blue blocking glasses, and before I get that question, I'll talk about that in just one moment, which ones are these and where you can get those, but I just have a pair of my glasses sitting by my bed, so if for some reason I had to go up in the middle of the night, I just put on my glasses and then go do what I need to do. So,
Would a salt lamp be like an amber enough color for a nightlight?
possibly. Yeah, the question, because they put out different wavelengths of light. Like, so earlier it's that analogy of Keishi and the point. You just don't know what wavelength of light is coming off some of those things. Yes, ma'am.
Some of us are pretty hard of hearing, and at night we take out our hearing aids, so I can't hear the alarm on the cell phone if it's 50 feet away.
Well, my recommendation for people to do that then is actually just get an old school egg timer and set the number of hours that you need to sleep. It'll ding in the morning time, and you don't have anything electronic by you.
Like a kitchen timer?
Yeah, they have kitchen timers. Well, find a super long egg timer. If there's not one, I'll invent one.
So you mentioned that on airplane mode, it's still not, that's not good enough?
It's better than not, but there's still other things coming off the phone. So,
Maybe like a battery.
what's that?
A battery.
Yeah, battery powered, alarm clock would be key too. Or if you have a LED one, you want it to be red LEDs because that won't affect as much. But ideally, you don't have anything that's bright at nighttime in your room.
You're talking about the phone, what if you have like an iPad that has like sleep, noise to like your, white noise and stuff? If you've got an iPad, is that as bad as, you don't have a phone, but you've got an iPad there that's got a sleep mode working, is that bad?
If it's attached to Wi-Fi or has a cell phone module in it, yes, it's the same as having one. So, if you put it in airplane mode, it's probably going to be okay. But it's one of the things, I usually frequently say test, don't guess. And so you can get, radio frequency monitors as an EMF detector. And, green is good, yellow is bad, red's thing. So, probably won't be able to see it, but if I put it on my laptop because it has a Wi-Fi thing, it's going to be pegged to red. So you'd want to put this over anything that's near you, and if it's green, you're okay. So I usually, screen my house every once in a while to make sure it's still okay, but I usually just travel with this one. You go to a hotel, and every once in a while they have the Wi-Fi router right behind the bed. And so one place in Mexico, we had a horrible sleep for a while. We couldn't figure out why. It turned out that was the case, so we just switched and slept at the other end of the bed. Sleep was better that night.
Not just stuff in the head.
Right.
Yeah.
You mentioned the noise, the quiet. I can't do that.
No, we said white
What's
noise.
that? Yeah, white noise, okay. I usually use a fan.
Okay,
or something.
okay.
So,
Now we're
yeah,
talking.
so yeah, it's just that.
Great.
I do both.
Another
Right.
excuse for more fans.
Right.
One noise in the fan.
Yeah, the white noise is generally okay, or ocean sounds, that stuff. It's just that you don't want to be falling asleep to basically words, TV and such like that, because you essentially can program your subconscious. You won't understand what you're hearing, but if you're watching like TV news while you're sleeping and hearing the negativity of the news, your brain is going to be wired for that while you're sleeping, and you're going to wake up anxious, and you're not going to know why. So words have meaning, and your subconscious listens to it all the time. So white noise isn't going to be a problem, but you don't want to be listening to crazy TV stuff while you sleep. And again, I should mention about that. Your bedroom should be for two places only, sleeping and sex. You should not be watching TV in bed or reading in bed because you don't want to condition your brain that bed is for anything other than recovery. So if you have a TV in the bedroom, ideally get it out of there, but if it's in there, you shouldn't be watching it while you're sitting in bed.
So what about the infrared saunas? Are those good?
Yes, they can be good. There's different wavelengths. There's near, mid, and far infrared. The near tends to be more stimulating for the mitochondria. The mid and far are more going to cause you to sweat. And so saunas have a long tradition, mostly in the Japanese culture, for heart disease treatment. So there's definitely data that it's, helps you detoxify from heavy metals and plastics and things you've been exposed to. But that heat also can stimulate the mitochondria. So saunas are generally good. You just don't want to do it too close to your bedtime because you don't want to have a real high temperature and then try to go to sleep.
So the infrared's better than a regular dry sauna, right?
Not necessarily, just generally it's more efficient. The drier saunas usually at higher temperatures, but they both work.
I got a question about calcium supplements. As we get older, we're supposed to take them to worry about them building up plaque in our arteries.
That is correct.
So,
Yeah, so calcium, ideally you get it just through your diet. So, get it through your green leafies is one of the best sources of calcium. you know, I'm not gonna tell you to stop taking oral calcium supplementation if that's what your healthcare provider recommends for you, but typically if you're taking a lot of oral calcium and you have low vitamin D or you have low vitamin K2, calcium is gonna go wherever it's gonna go. And one of the places it does is it builds up in the arteries. So for patients who have a lot of coronary calcifications, I'm typically making sure their vitamin D levels are optimal in their blood work, and vitamin K2 also helps put the calcium back into the bones and teeth. So calcium is extremely important for cell signaling and also the way that heart electrical signals get transmitted. So you don't want to mess up and have low calcium, but for bone health, what you're doing here and optimizing vitamin D and being out in the sun is going to be way more important than popping a calcium pill.
Okay, because I take one with all those things you said in it, but it's from algae, and there's 3 different kind of calciums. That's why I was curious.
Well, there's calcium acetate and carbonate, and yeah, they're all absorbed a little bit differently.
There's different light bulbs you can use in the house. The light or the cool blue versus the warmer yellow.
Mm-hmm.
What's your recommendation there?
So the old incandescent bulbs are the best if you could still get them. Halogen's probably the second best. The reason that I say best is just from a physiologic standpoint. They're more similar in wavelengths to the sun than the new LEDs and the halogen, I shouldn't say the compact fluorescents tend to be. So the older bulbs, you know, were putting out heat. That was inefficient from an energy standpoint, but your body was supposed to see that wavelength of red, and that heat is infrared. These LED bulbs that are extremely bright have much higher peaks of blue light. They have 4 to 5 times the amount of blue light than an older bulb did or that the sun has. So your body gets a signal from the light bulb, it's July, it's noon. Start jacking up your cortisol. So it's the color of the light's important, but also the intensity or the lux of light is also important. So if you see on the light bulb it has Kelvin, the lower the Kelvin, the better it tends to be. But ideally, once the sun sets, I'm not saying everybody should be using candles, but you should be minimizing as much light as possible and just using more task lighting when you need to use lighting in certain rooms. But you can go to Home Depot or Lowe's, and for 10, 15 bucks, you can get just a red LED bulb. I don't know exactly what wavelength the light's coming out, so it's not going to be a therapy device, but the red light isn't going to affect your melatonin levels. So I have like 2 lamps in my house that have the red bulbs in them. One's in the living room, so the living room is pretty much always red at nighttime. And the other one is, an image is kind of minimizing the technology, is Wi-Fi. Unless there's something in your house that absolutely requires Wi-Fi at night, turn your Wi-Fi off at night. That just basically, Wi-Fi is a radio signal, and it's it's a cell jammer, cell signal jammer to your mitochondria. So I have a room that there's a red light on it, and it's plugged into the same strip that the router is. So if that red light's on, I know my router's on, and I just flip the switch, flips off the Wi-Fi in the router.
I doubt most people turn off routers at night.
Probably not, but it's probably a good idea.
I'm gonna tonight though.
Yeah.
She'll have
I
to do
mean,
it.
if I had the options, I probably would go back to Cat 5 cable on the walls, but that's not always doable in many places. So use Wi-Fi when you need to use it, but shut it off otherwise.
How long did you say in the morning you go out in the?
So sunrise
Daybreak?
usually it depends on essentially how warm it is, how long I'm actually going to force myself out there, but 15-20 minutes is kind of optimal because that's what your body needs to really get the signal. Okay, it's morning time, make hormones this way, I'm going to start getting sleepy in 14 hours from now. If you wait and see light at a different time, your body's signals of when you're going to release melatonin will probably be off. And so the other thing is that if you get up in the middle, I usually get very early, I'm up before 5, but when I get up before 5, I'm wearing some type of glasses to protect my eyes because I don't want to tell my brain it's already sun time or sunrise time. So I wait until sunrise before I take the glasses off.
So when you do that, then you're up for the rest of the day, right?
What's that?
If you get up for sunrise, then you're starting your day at sunrise.
Correct.
You can't go back to bed.
No, not necessarily. I mean, it's if your body feels like you still need more rest, listen to your body and get the rest. But because there's certain places in the world where there's like 24 hours of sunlight, and then there's times where there's like 2 hours of, darkness. So, what do? You get up at 2 a.m. to go see the sunrise? If you're really a sick individual, the answer is probably you need to move south where there's more 12 hours of darkness and light. You're not going to do well where it's dark all the time. But if you want to try to get by, somebody we learned a lot of this lessons from was, yes, get up as early as it takes to see the sunrise and then go back to bed, because it just times the way your hormones are being made for the rest of the day.
Do the lamps that like they have, people live in Alaska or whatever, those light lamps, do those actually work or not?
They work for seasonal affective disorder. So seasonal affective disorder, at least 5% of the population has it. And it's essentially a disorder of lack of sunlight. There's 2 months out of the year in St. Louis that even if you're outside completely naked, you're not making any vitamin D on your skin. There's no UVB radiation getting through the atmosphere that time of the year. But there is still red light outside every day of the year, even if it's cloudy. So people ask about, the jukeboxes and the infrared saunas. When it's cloudy outside, that's basically a sauna day. So even if it's cold out there, the light still is important. And it's the intensity of the light that's also important. So even if it doesn't look bright out to you, it's the lux. So these lamps are probably 300 lux. You go outside during noontime, it looks bright to you, but you don't understand. It's 10,000 lux at that time. It's orders of magnitude higher. But there's receptors in your eye that can tell that intensity. And so when you get that intensity, certain chemical reactions happen. But those light boxes can augment it, but you still need to get out of the natural sun.
The melatonin I take every night to sleep, it really isn't doing anything?
It's not that it's not doing anything, but the better question is, why do you think you need to take the melatonin? Is it, I have to take it because I can't sleep without it? Well then, what are you doing during the daytime that's destroying your melatonin? The answer almost for everybody, before I knew this data 3 years ago, is you live indoors a lot of the time and you use technology most of the day. So if you're on your phone, your iPad, your computers, this light is draining your melatonin levels essentially. And the way you preserve it is you protect your eyes. So you wear glasses. You shut off the light at nighttime. You use the software in your computers that dial out the blue light at nighttime.
Well, I just use it to get to sleep. I have a hard time getting to sleep.
Right, that's melatonin's main job, is that it starts the process of sleep. But there is data, and there's a published data on an article I read this week even, that shows that if you take chronic oral melatonin, you can thin out the retinas and cause retinal bleeding, which can potentially lead to blindness. So it's something that I don't recommend to any of my patients at this time. A few years ago, I'd recommend melatonin all the time. Oh, it must be very safe. Use it. But right now, the only instances I ever recommend melatonin really are for short-term use, especially if you're doing a lot of flying and trying to kind of reset jet lag. Maybe this weekend with springing forward. Spring forward is a horrible idea. It raises the risk of heart attacks by like 20% for that week. You're messing up people's circadian rhythms when you do that. So taking melatonin next weekend might not be a bad idea for 1 or 2 nights to get yourself reset so you get back on your normal sleep cycle. But if you have to take it every single night for weeks and months and years on end, you can damage your eyes with that. So protect your eyes with glasses, and you won't feel that you need to take as much melatonin. I had a question back there.
Yeah, does wearing sunglasses affect your circadian rhythm?
Yes, sunglasses do affect your circadian rhythm. So sunglasses are a sticky topic for many. I can tell you I was a sunglass addict up until 2 years ago. I have blue eyes. Sunlight used to make my eyes tear the second I'd walk outside. So even in the wintertime, second outside, sunglasses on. But basically weaned myself off sunglasses over about a 10-day period, and have been to places that are extremely sunny multiple times. If it gets too sunny, I just put a hat on or hide it back in the shade. But sunglasses filter the light signal that your eyes and brain get. So your body is supposed to be exposed to the full spectrum of light. If you filter out certain light, your body doesn't get that signal, you don't make certain hormones that way. So it's not a good question like, is sunglasses never? Not necessarily. There's situations, you're driving, it's bright, you can't see the person's tail light in front of you, fine, wear your sunglasses for that period of time. You're out on the water and the water is reflecting the light into your eyes, you're snow skiing, the snow is bouncing into your eyes, wear it at that time. But other periods of time when you can, put your sunglasses up and get the natural sunlight into your eyes.
So first thing in the morning, I've gone outside and tried that, looking at the sun, and I can't hardly open my eyes. Does it take a lot of conditioning yourself to?
You can condition yourself over a little bit of time, and you don't have to stare directly at the sun. In the morning time, there's no UV radiation coming from the sun, so you're not gonna hurt your eyes per se. So, basically, one of the colleagues that, taught us all that stuff, he says, act like the Sphinx. Go out in the morning, face east, ideally be grounding, and your eyes are facing the sun. You don't have to stare at the sun. You can face 15 degrees off from the sun, or some people like to look like the sun rises and just look at the horizon below it. But as long as the light's entering your eyes and hitting your skin, that message is getting received.
How does naps affect your physiology in that respect? You take an afternoon nap.
So the question is always about, what is the reason you feel that you need to take the nap? If it's just that, you got poor sleep the night before, well, what hurt your sleep, and try not to do that type of activity. But, if you need to sleep, that's time that your body is repairing itself. So if you feel like you need to sleep, get the sleep in. But a couple things, more tips, is that don't take a nap too late into the day, because you can start destroying your sleep inertia. So it's gonna be harder for you to fall asleep again that night. And ideally, don't take a nap past 90 minutes, because your sleep cycles are about 90 minutes long. So you go through a phase of light sleep, deep sleep, REM sleep, and you kind of bounce between all these different stages. If you go more than 90 minutes, you'll wake up in the middle of one of these stages and likely have a lot of grogginess and feel like you feel worse than if you just slept 20 minutes. So try to keep it under 90.
How about these people that are on shift work, where they're working evening or midnight shifts? Because now they're sleeping during the day.
Correct. Just how to mitigate that, or?
Right. Because they go back and forth. They don't, some people don't just stay on midnights. They do, 2 and 2 and 2.
So that's one of the reasons I transitioned into starting my own practice the way I did, because I didn't want to be up in the hospitals at 2, 3 a.m. taking care of heart attacks for the rest of my career. It's exciting, and I always, I'm grateful to help any patient I can, but that was going to take a major toll on my health if I did it for the next 20, 30 years. So shift work, which I did for many, many years, is literally by the World Health Organization, is classified as a carcinogen. Not as bad as smoking, but it's getting close to it. And actually, all the data will probably come out later, that when your circadian rhythms are broken by shift work, it's actually going to be worse than most things that people think cause cancer. Because if you don't sleep and your mitochondria don't repair themselves, that's when cancer starts happening. So ideally, try to get on day shifts, because your body needs sunlight to program the hormones the way it needs to. But if you're going to do shift work, protecting your eyes as much as you can. For 2 years, I wore a different set of glasses when I would ever be in the hospital. I didn't care what people thought, like I called names or thought it was funny. I controlled the light that was entering my eyes, and I sleep perfectly fine at this time. So they're gonna have to really be tight on their light hygiene when they're under artificial light. At times their body's not expecting to be awake. And then once they're home and trying to sleep in the daytime, their sleep cave's gonna have to be absolutely dark, because light is going to be telling your brain it's daytime, stay awake. In the back.
So, for people who are like not a biohacker and listen to all this stuff and they're like, I'm just not gonna be a biohacker. You could list like the top 3 things for somebody who's not gonna be a biohacker, or they don't think they can be. It seems like the glasses are like a sure thing, kind of to help with a lot of the things you talked about, and you can mention what brand, maybe
Sure.
there's a brand you recommend. But like first, second, and third, if they could go home like right now and say, okay, these are a couple things I could really start to do right now, and it wouldn't freak me out too much with my lifestyle. What would be your top 2 or 3?
Sure, great question. So I'll take the glasses one first. So this is one of the instances where quality really does matter, and there's a lot of marketing going on right now with blue blacking glasses. So it's not as easy as just going to Amazon and typing blue blacking glasses, because you don't know exactly the quality that you're going to get. Again, it's extremely technical sometimes, that the wavelength or the spectrum of light that gets through the glasses is important. So there's basically 3 brands that I personally wear and will recommend to patients. There's one 4th one, and I'll talk about that in a second. The brand I'm currently wearing is Raw Optics, R-A like the sun god, optics.com. They probably have the best technology for lenses right now. So you're going to see my previous, actually those glasses there, you can see those, I'll talk about those. you see those look more yellow. So these ones, if you came up to them, you can tell they're a little bit yellow tint, but the average person would know these are a pair of blue blockers, because these block explicitly 450 to 465 nanometers. That's the major spectrum of light coming off your technology. It has to be somewhat yellow to block that wavelength. So if your glasses are completely clear and they're called blue blockers, they may block some of the lighter wavelengths of blue, but not the ones that are actually doing the damage.
Mine are completely clear, so that's great to know.
Correct. So that's why I tell people quality matters. So Raw Optics makes good ones. So they make two versions. They make the ones that wear during the daytime that let some blue light through, because you need some blue light to kind of stay awake throughout the day. But once the sun sets, these ones block all the blue light. So normally I don't wear these in the daytime because they start making me tired. So I'll make my wife drive me home tonight or something. But these ones, you know, if you only get one pair, get the day ones. If you can afford two or want to really experiment with it, or you have really bad sleep, then get these darker ones, because if you put these ones on an hour or two before bed, these really will help people get sleeping better. The other brand I recommend is Blue Blocks, BLUBLOX. They have technology that Raw Optics was previously using. Some of their frames fit people a bit better. My wife tends to like their frames better than Raw Optics do. The only caveat with the Blue Blocks is that they're an Australian company. They have great customer service, but if you ship something, doesn't fit, you don't like it, they'll take it back, no problem, but it's gonna cost you like $15 to ship it back, take 10 days, 15 days for them to get it. So it's kind of a game to kind of get it back, but they make great stuff. And then the third company is True Dark. That's the one that Asprey originally kind of helped found. They're sold by a company called Biohacking.com. They make different ones. Those are the ones I typically will recommend for people who have prescription glasses and I don't necessarily ever recommend people go for prescription blue blockers unless they know what they're doing, because it gets tricky sometimes. If you really, I'll tell you in one second how you can get prescription blue blockers if you want, but True Dark or Biohack, who sells them, they actually have some of the glasses that are wraparounds to prescriptions. So they're not as bad as the cataract glasses. They're not really all that stylish, so you're probably not going to want to wear these ones out in public that way. But if you're at home, they're fine and they work for what they need to do. And they make both the yellow ones and the red ones on those ones.
The yellow during the day, red at night.
Pretty much. And then if you really want a prescription one, Raw Optics will make you a prescription one. And
Blue blocks.
yeah,
Blue blocks.
Blue Blocks will too, but I don't know. I'd be worried to send something to Australia and get a prescription set made from them. But they will do it as well. But there's a company called Blue Tech Lenses. That's basically the lens manufacturer. So if you just look for Blue Tech Lenses, they have different optometry and ophthalmology shops in St. Louis that certain companies will do it. They will put this BPI tint into a prescription glass for you, but it's going to be probably $300-400 to add this tint to your prescription. So prescription glasses will work, but unless you really know what you're doing and really want to do them, I say most of the time just get the ones that overlay.
And the company again that do the overlay?
Biohacked.com.
That's,
And if you go to my website, there's actually a link to that one.
What about children, my grandchildren that are on screen time so much?
Great question.
Do they make glasses for children,
They do.
things like that?
Yeah, all three of those companies make glasses for children. And children's brains are more susceptible to this blue light hazard. Their brains aren't fully myelinated until they're 25 years old. So they need to even be more vigilant. And so this is one of the reasons why there's such an uptick in anxiety, ADHD, all these things that, you know, when I was a kid was present, but not nearly as prevalent. So if, you know, I'm known as the uncle who is the killjoy to some of my nieces and nephews, because I'm like wearing the glasses and like, oh, Uncle Mike's wearing the glasses again. So none of the kids ever actually want to wear the glasses. So my brother's wife, you know, she basically made their screens be more, you know, warm at nighttime. So she went kind of the software route because kids wouldn't wear the glasses. But, you know, maybe if all families wearing the glasses, they'll do it. But it's extremely important. You know, if the kid doesn't sleep well, that's the first place I would look, is try to control their light environment at night.
But even if they aren't having trouble sleeping, it's still not good for them to have that much
Yeah,
screen
you're
time.
exactly right. Yeah.
And they just wear the glasses when they are on.
So, you know, the most important time is in the evening time, because you wouldn't have been exposed to bright light in the evening time until the light bulb got invented. And the body hasn't evolved that fast to be able to tolerate that much light. But ideally, anytime you're indoors under artificial light or in front of a screen, you protect your eyes. So I usually call mine like indoor sunglasses. So I wear indoor sunglasses, I don't wear outdoor sunglasses anymore.
What's the software that you recommend for the computers for?
One is called Flux, Flux. The other one is Iris. They both work well. Iris is probably more technologically tunable, so I like Iris, but they both work. And back to your original question, what are the 3 tips? Always go back to light, water, magnetism. Those are the 3 things that every planet needs for life to be sustained. So light, see every single sunrise. The more sunrises you see, the better you're gonna do. We'll do water, drink clean water, ideally stuff that doesn't have fluoride in it. Your body's, mitochondria make the water that your body truly needs. This is a complex topic, and if you ever want me to have back, I'll talk all about water physiology and deuterium, but water, clean water is key. And the magnetism, that's earthing and grounding. So, get outside barefoot, 15-20 minutes a day, that can help. The other thing that helps with magnetism is cold. So if you're into cold showers, you're doing the cold tanks, that can help with the magnetism part. So you get light water magnetism right, the mitochondria are happy, you'll be happy.
You guys have any other questions?
I'll be around for a little while if somebody has a one-on-one question or something like that. So thank you guys again.
Thank you so much.